Hi, my name is Shannon Wichurata and today is the 10th of May. In this video I will be demonstrating the correct clinical and communicational approach when dealing with a 78-year-old Mr. Jones. I will be palpating his pulse rate, measuring his breathing rate, palpating and oscillating his blood pressure, forming a chest oscillation and giving him a full Glasgow Coma scale score, whilst showing the correct verbal and non-verbal skills. Alright, Mr. Jones, I'm just going to take your pulse rate if that's okay. Yeah. Have you had a pulse rate taken before? Yeah. Yep. Could you just extend your arm out to me? I'm just going to place my fingers on your wrist to take your pulse. That's alright? Yeah. Yep. I've got my fingers on Mr. Jones's wrist to feel his pulse rate of his right arterial. I'm checking to see if his rhythm is regular or irregular, and the characteristics of a weak, strong, absent, or thready pulse rate. Whilst I'm doing this, I'm going to check for his breathing rate as well. So the first 30 seconds I'll be checking his pulse, the next 30 seconds his breathing rate. So I will be doubling his pulse and his breathing rate. Checking to see if he has deep, shallow, or light and faint breathing movements. Yep, that's fine, Mr. Jones. Your pulse rate is approximately 78. Is that normal for you?
Yeah, no.
Yep, that's in the healthy range of 60 to 100, so that's good. And with your breathing, do you feel comfortable breathing like that?
Yeah.
Are you a smoker or do you try that smell?
No.
Yep, it reflects on your breathing because you have a breathing rate of approximately 14, which is between the normal range of 12 to 16. The non-verbal communication I expressed during these two parts were I was smiling at him, I held his hand very gently, I was down at his level and I maintained a comfortable distance between the two of us, and I nodded when he was responding to my questions. Alright, Mr. Jones, I'm just going to take your blood pressure if that's okay.
Yeah.
Have you had your blood pressure taken before?
Yes, I have.
Yep. Could you just extend your arm out to me? Just relax it. And is it alright if I move your sleeve up?
Yes.
So I'm just going to place the cuff around your upper arm. You'll feel a slight tightening sensation, and I'm just going to place my fingers on your wrist again if that's okay.
Yeah.
And it will tighten up soon. I'm just palpating Mr. Jones's blood pressure to find a systolic blood pressure. I'm placing my fingers on his wrist to gain a systolic blood pressure reading. I pumped it up to about 30 above what I think it might be, and as soon as I feel a throbbing sensation, give me his systolic blood pressure. So I've got a reading of about 90. So Mr. Jones, your systolic blood pressure is about 90. Now I'm going to oscillate your blood pressure and place this. Do it again if that's okay with you.
Yeah.
Yep. I'm going to oscillate Mr. Jones's blood pressure. This will give me a more accurate systolic and a diastolic reading. Mr. Jones, I'm just going to do that again. Are you ready?
Yep.
Yep. Are you comfortable in that position?
Yeah.
Yep. Okay. I pumped it up to about 30 above the systolic pressure just to get a more accurate reading. As soon as I feel and hear a throbbing sensation, give me the systolic, and when I don't hear it, give me the diastolic reading. So I've got 110 over 78, which is much more accurate than the initial palpating reading. Mr. Jones, that's fine. I've got a reading of 110 over 78. Is that normal?
Yeah, sounds about right.
Yep.
Yeah.
The non-verbal signals and things I used were I was smiling at Mr. Jones, I was down at his level. I used very gentle and comfortable sort of movements with my hands, and I reassured him. Jones, I'm just going to look at your chest, if that's alright. Have you had a chest examination before?
Yeah.
Yep. Is it alright if I lift up your shirt?
Yeah, it's fine.
I'm going to oscillate Mr. Jones's chest by lifting him to 10 positions on his back and his lungs. Mr. Jones, could you lean forward a bit? Take 3 deep breaths in. And stop, and could you continue to keep breathing while I perform the exam?
Yeah.
I'm starting at the top of his lungs and positioning all the way down. I'm listening for any crackling or wheezing sounds, and it appears that his lungs are filling up from left to right and in equal proportions. Yep, there seems to be no sign of any wheezing or crackling in his lungs. Air is filling up from the top of his lungs to the base, and I can hear air in the bottom of his lungs, which is really good. So, Mr. Jones, that was fine. Do you smoke or have asthma? No, that's really evident in your lungs. I can hear the air going from the top to the bottom, and it's really good. The non-verbal gestures I used was I smiled, I gently lifted up his shirt, was polite and down on his level. I was comforting and told him what I was going to do, and he smiled and nodded. Mr. Jones, I'm just going to ask you a few more questions. That's okay with you?
Yeah, of course.
Do you know what day it is today?
Friday.
Yep. And do you know where you are at the moment?
Yeah, I'm in my front garden.
Yep. Would you mind squeezing my fingers for me? Okay. Yep. Mr. Jones has spontaneous eye opening, and throughout the exam I could see that he was responding to my verbal commands, and he could recall what day and where he was. So I will give him a score of 4 and 5 for his verbal and his responses. He squeezed my fingers really well, so I'm going to give him a motor skills score of 6. Overall, I'll give him a GCS of 15. The non-verbal responses I used when I was talking to him were smiling, asked questions, I was polite, I nodded, and I was down on his level and remained in a comfortable distance